Today we have a very special guest. We have Amy Leiferman. So welcome to the Gut Health Dialogues. Amy is a seasoned counselor with over 25 years of experience in eating disorders. Her journey began actually as a nutritionist, where she spent 2 decades doing that before pursuing a graduate degree in clinical social work. Now she specializes in helping clients uncover and resolve the root causes of disordered eating and other mental health challenges like depression, anxiety, trauma, and food mood issues, all from a holistic perspective. Amy's approach integrates EMDR therapy and mindfulness techniques. So, in today's episode, we are talking about EMDR therapy, particularly in its application to gut health issues exacerbated by anxiety and trauma. So I'm really, really excited about this topic.
Me
So
too.
welcome,
Thanks for
Amy.
having me. Yes, I'm
You're
very
welcome.
excited to explain how all this works.
Yeah, and I thought it might be a good idea to start by talking about the gut brain connection and why we even need to focus on anxiety and trauma as it relates to gut issues. Because I know working with a lot of people with IBS, SIBO, and other gut issues that a lot of people have no idea that their emotions have anything to do with their digestion.
Yeah.
So, did you want to talk a little bit about that, or I can?
Well, that's what I had seen as a nutritionist is just the relationship between how stressed people were and then the physical symptoms that often is in their digestive system. So the link between the two is what led me down the path of, you can give people all the dietary advice that you want and you can make a big difference with that, but then if a stressful event comes in, then your whole nervous system is out of whack and then your digestion is out of whack, and it could be anything. So it could be a big stressor, it could be a little stressor, and it's often tied back to something from a really long time ago that your body and brain didn't process yet. And so by doing the EMDR, that's how we kind of get to the next step of recovery.
Yeah, so I agree with all of that. Actually, that reminds me, why don't you tell us a little bit about it? Because it's interesting that you started as a nutritionist and now you're a counselor. So what did lead you to move in that direction?
I didn't even know what EMDR was until I went to therapy like 2 decades ago. When I went to therapy, well, maybe it wasn't that long ago. She was an EMDR therapist. That was the first time I'd ever heard of it. So she did EMDR with me. And that was the first time that I actually noticed a shift in like internal shift of how I felt. Because, you can talk about things like talk therapy works and mindfulness and all of that. But the way EMDR works is it's piecing together events and emotions in your limbic system in your brain. So it's like neural pathways wise, it's changing what's going on in your brain, which then leads to a cognitive shift. So it's almost like if you had, say, you just had like constant anxiety, let's just go, mine literally was in my stomach. So if it was like constant there, then it just starts to lessen until the same situations that you were in, just they don't bother you, like nothing happens anymore. So
Mhm.
I did it myself. And then after, when I was doing it and I was still working with clients with eating disorders, I wanted all of them to do EMDR. So I was like, you need EMDR and you need EMDR. And I work in an office with 5 different counselors and they did EMDR too. I decided then that I was going to someday I'm going to do this. And, I already had graduated years ago. And then before that, I had a different degree. So I was like, am I really going to go back? And I just felt called to keep figuring it out. So I went back little less than 10 years ago, but I went back to grad school, particularly so that I could be an EMDR therapist.
That's amazing. And I can definitely relate to that feeling of, okay, we can take it so far. I mean, we get really good results with some of the diet therapies and when, especially with functional nutrition, when we look at the gut imbalances and the bacterial imbalances and the digestion and all of that. But like you said, especially when somebody has anxiety that's now tied into their gut issues, because whether it's the chicken or the egg,
Right.
now they're nervous because they're traumatized about maybe having an accident in their pants or having embarrassing gas. And So it's a really tough thing to unravel. And I think that it can really slow down their progress, because even once they know how to control it, if they don't do something about their anxiety, it just becomes a vicious cycle. For example, I'll have people ask, well, how long do I need to avoid these foods, or how long do I need to take these supplements? And the answer really boils down to, for some people, well, if you're still in a toxic relationship, or if you're still in this anxiety all the time, you're going to need a lot of support to keep you going from a physical perspective. So I'm all about finding the root cause. And for a lot of my clients, it's anxiety or past traumas, right? So I thought I would talk a little bit about the gut-brain connection, because again, I don't know if people really fully understand this, but if you think about when you get nervous, where do you feel that? In your stomach. There's a very strong connection between the brain and the gut. And it should be like an open highway where there's communication back and forth, because not only does your brain communicate. So another example would be when you smell a food and you salivate. You haven't put the food in your mouth yet. The brain is sending that signal to your gut, that to your digestive system, that there's food. And when your mouth salivates, your entire digestive system salivates, meaning your stomach starts producing acid, your pancreas starts releasing enzymes, and your gallbladder starts releasing bile. So you're getting 20% of digestion going, even when you just first see or smell the food. So there's a very strong connection. And what happens with stress and anxiety is it pinches off that connection to some extent, because we are designed to be able to direct our physical resources, meaning nervous system signaling and blood flow, out to our extremities when there's a stressful situation, because stress is supposed to be acute, short-lived. There's an immediate threat, we run to safety, and then we can calm down. But in our modern lives, and with everything that we're dealing with and worrying about and rushing to do, fit into our schedules and all of that, we're in this stressed state. So it's a fight or flight state a lot of the time. And that interferes with our digestion. So we'll talk more about that, but that's kind of the basis of this, right?
Yeah. And so then where the EMDR comes in is the way your body has processed like an old trauma or old negative event. It was like your body never really processed it. Like your brain never really processed it. So it's stuck in like an area of your brain. So your fight, flight, freeze, like was your amygdala is like firing like that you're in danger, but your body couldn't process it at the time. And so it's stored in an area of your brain, but there's no story that goes with it. So it's just the feeling. And so that's like stored in your body. So what you're doing with the EMDR is you're going in and kind of accessing the memory, and you're tying it to the feeling in your body. So then it starts to dissipate, and then it stays in the past. So what's happening is people could get stressed about something today. Like say I have a meeting every Friday, I meet with my boss, and by Thursday night, my stomach is a mess. I have acid reflux. I can't eat or whatever it's going to be. And it's like, okay, so what's so scary about meeting with your boss on Fridays? And they might not even know, but when you're setting up the case for EMDR, you figure out what people's core negative beliefs are. But they just came to see me for that. They're just like, I have anxiety at work all the time. I hate going there, or whatever it is. And so if we're just asking about the incidents with the meeting with their boss, and we'll say, okay, so what happens in the meeting? And it's like, well, I get nervous, so I don't say anything. And then I look stupid. I feel stupid when I go in there. Then I just think I'm stupid. And you're like, okay, is there another time in your life where you felt stupid? And they're like, well, I don't know. So then you do their trauma timeline. Okay, think back to the first time, even if it was something little, they'll be like, oh yeah, in third grade, my math teacher called on me and I didn't know the answer. And it was an easy answer. And all the kids were staring at me. And then a kid called me stupid. And then you'll go, so that's third grade. So that's like incident number one encoded in your nervous system. And that's a big deal in third grade. So then say it happens again in middle school and it was like a coach and you didn't get picked. You're like, well, now I feel stupid. And then you just like kind of collecting things as you go through your life, or being compared to a sibling and you feel stupid. So it just gets stronger and stronger and stronger. And you don't even know that. But then Thursday nights before you go in with your boss, you feel stupid. So you do the EMDR on the youngest memory. If people don't know it, if they're like, I've never felt stupid before, they might not know. So what you do is you put on the EMDR equipment, which I know we'll go into in a minute. So you do the EMDR processing, and it's almost like watching your life go by. Like if you're on a train and you're watching your events go by on a window, and then you just see, oh, that memory, that memory. And so you'll be doing the EMDR and it'll be like, well, I don't know. People always do this like, well, I don't know why this came up. And it's because it's completely related to what we're doing. But it'll be like, well, now I'm at the fourth grade book fair. And then this whole thing happened at the fourth grade book fair. But you never even knew that coming to therapy because you're stressed at work. So,
Yeah. So people don't come to you saying, I have issues with feeling stupid. They say, I'm stressed about my boss. And
mhm.
you get down to these roots.
Right. So that's
That's
how the
amazing.
EMDR processing works. So it's a whole setup period. This goes in phases. So the first whole two phases are the setup and the case conceptualization, and you do their trauma timeline. So you can't just like the first day, please do EMDR. Some people come to you for EMDR and like, I want to do it today, like get this out. But
Yeah.
other people don't even know what it is. And they'll be telling me, just about their life. And I'm like, oh, that's like a really good topic to use. And so it could be anything. It could be I'm unworthy, that I'm stupid, I'm not safe. So any negative cognition that you have, usually people have more than one. So it's not just that I'm stupid.
Yeah.
So usually people have like channels. And so I would say people have 3 to 5 different channels. So
Hmm.
I don't matter is a good one, not a good one, but a common one. And then I'm stupid comes up a lot. So what happens then is we categorize them. I would have send somebody home with a trauma timeline and say, start with your first memories, preschool. What happened in your life? So they could be like, okay, nothing significant here. But then at this age, I was bullied. At this age, I went to a new school. This age, my parents got divorced. So you start to come up with their core belief, like their negative core beliefs about themselves. And then when you're doing the EMDR, you pair it with a positive belief. So you desensitize the old, then you pair it with the positives, probably with the I'm stupid. Say you have a college degree and you just got a raise, or there's no evidence that you're stupid. So you put in I'm competent, but you still have to pair it with the event. So it's like, well, how true is it? And you use a scale of how true it is. And they're like 0. When I'm going into this meeting, it's 0. I'm not competent. So you desensitize the negative one and then you install the positive one. So then their nervous system starts recognizing, oh, I am competent. And then your brain starts thinking, oh, yeah, I have evidence based on this, this, this.
Wow, that just
Mhm.
sounds so amazing. And when we first talked about it the other day, and this is something that is evidence-based, right? And it's been
Right.
around a while,
Mhm.
but I haven't heard very much about it. And I feel like almost everyone could benefit from this,
Yes,
right?
they can. It doesn't matter if the kid's 12 or, 52. It doesn't matter. You can use it for anything now. And kids are just under so much stress too. So you can use it for anxiety, depression, phobias. You can use it for chronic pain, grief. You can use it if a kid's going through just their parents' divorce and just feeling like I don't matter, or just I can't handle it. That's another one. It's like I cannot handle this. Or they'll want to do homeschool because they cannot handle it. So that
Mhm.
goes to a whole part of their nervous system. So we kind of installed, well, yes, you can handle it. But when it first started, that was in the late 80s. So Dr. Francine Shapiro, she just discovered it. And she discovered it with rapid eye movement. And then she studied it from there. And mostly it was done with people with PTSD. So life or death, big accidents, people at war, stuff like that. And it worked really well. So they started doing all these clinical studies. And now there's over like 70 different studies. It's used in 130 different countries. So World Health Organization recommends it, American Psychological Association, SAMHSA, National Institute for Mental Health. So all these different organizations recommend using it as like the gold standard for trauma treatment.
That's amazing. And I think it can especially appeal to people because I agree with you that talk therapy is amazing, but I think it can appeal to maybe a person who doesn't like talk therapy or who wants maybe more science focused, right? And they
Right.
want, can you explain a little bit about the science and how it works?
So basically, like where your amygdala is like down here, and then you have your hippocampus and then your prefrontal cortex, right? At the time of whatever happened, your body didn't process it. It's just stored in a place where your amygdala still senses danger. And so by doing the EMDR, it's using bilateral stimulation to access those parts of your brain. And it's almost like linking them together to diffuse the emotions and then putting a story to it, because it's just like you would have froze up. And so you just knew something bad happened that your body couldn't handle. So you never even processed it. So we could say, okay, like the thing in the third grade with the math teacher wasn't that bad now if you look at it, but your body doesn't know that, right? It feels like it happened yesterday. So what the EMDR does is it gets it further and further in the past. So the way that it works is they used to just do it with the eye movement. So originally it was just the back and forth and you follow the therapist's fingers back and forth. We don't really do it that way. I'm sure there's some therapists that do it that way, but when I had it done myself, she had the headphones and the tapper. So that's how I do it. My clients like that better. So the way that it works is like you take the headphones, okay?
And what does it stand for? What does EMDR stand for?
Oh, sorry. So EMDR stands for eye movement desensitization reprocessing. So it's almost the same as REM sleep, where your eyes are going back and forth, and then you're processing your day, and then you have dreams, and your body's naturally processing events and things in your environment. We don't know it's doing that, but I think you go into it like twice a night. But this is where you kind of skipped over actually processing what happened.
Okay.
Okay. And that's what Francine Shapiro discovered, is you can get to these memories by the rapid eye movement. Then it kind of like progressed from there. That's bilateral stimulation, and that's how you're getting there. Then the headphones, so say you put the headphones on, okay, and then they beat back and forth. You can do it just with the headphones, or you can do it with, the other thing is these tappers. So you can do them with the tappers. I do it with both, just because that's how it worked on myself. So we put the headphones on and you're holding the tappers, and the therapist would have like the control panel. And so we would set it for both of them to be 10 or 15 seconds. And you have the person recall the memory and you say, okay, where do you feel it in your body? How strong is it? And then they're bringing it up on purpose.
You said they might not know that this goes back to third grade. So how do you get to that point?
Well, sometimes when you're doing the trauma timeline, you can get back to that just talking it out. But most of the time, like, I guess I felt stupid in college, right? And so then when you start doing the EMDR, you're like, oh yeah, and then there was this time, and then there was this time. So it's not even stuff you remember. So doing the EMDR itself will like bring up the memories.
Okay.
Or some people just remember if they were bullied, they'll never forget that. So like, oh yeah, in, seventh grade, I was called whatever names. That stuff they'll bring to you because they remember.
Okay. So you just start talking to them while they have it on.
So we've set it up all beforehand, because they'll still come to you. Say they came to us with the I'm stupid from the meeting with their supervisor. So even if that's the only place you're starting, they're like, nope, it doesn't go to anything else. I just feel stupid when I go in there. It's still going to take you back to all the other times.
Got it. Okay.
Okay, so you start with the current thing, or once you do the trauma timeline and you start connecting dots, you guys will start figuring out other times it happened. And then when you're doing the EMDR, like 20 more things you didn't even think of might come up.
Just come to their mind.
As like in a picture. And so we turn it off every 10 seconds or 10 or 15 seconds. And we say, did you notice anything? And sometimes I have a lot of clients that like to talk. And so we'll go through the whole exact thing that happened, which they like to process it that way. Other people are like, yep. And then they just like say what they thought of, and they don't want to talk about it in detail. And so then you go to the next thing. And so for people who don't like to talk a lot in therapy, it's really helpful for that too.
Yeah, that's what I was thinking, because there are people that don't, and they probably need it the most, right? Because they're not processing, if they're not processing it verbally, maybe they're not processing it.
They're just internalizing it. And that kind of goes to all the stuff you're saying about the gut health. Yeah, you're internalizing all these things. So it's your body's, it's like the whole body keeps the score. It's going to remember. And that's why people are kind of hesitant to go to therapy sometimes, especially teenagers. Their moms, you need to go to therapy. But the people with eating disorders too, eating disorder is just a coping mechanism, almost not feel your feelings. And when I was just doing the nutrition, and then the therapist would be doing all of the cognitive stuff and the root cause stuff. But if they weren't doing EMDR therapy, I was like, gosh, I just wish I had one of those EMDR machines just because I knew it worked on myself. So now that I'm doing the therapy, they'll go to a nutritionist to get their meal plan and all of that. But then if they're having trouble doing it or stuff's not getting better, then I'm like, okay, let's sit with, or if it's like, okay, they can't eat in front of people. And they're like, well, I don't know what it goes to. It goes to my eating disorder. And then we do the EMDR, and it'll go back to like, okay, at the dinner table, something one of their parents said to them.
Mm-hmm.
And
Mm-hmm.
so it's like just all tied together, so it can help for something current to something really, really old.
Yeah. And you mentioned you specialize in eating disorders. So, off the topic of eating disorders as we usually define them, I do see a lot of people with gut issues that are afraid to eat because they associate. And so, whether one day we'll call that an eating disorder, I mean, I think we're starting to kind of classify that as a real problem. But, they'll be afraid because food causes them pain. And so do you
Mhm.
see this being helpful for that? Because I'll find that even once I help them find safe foods, we're able to calm down symptoms beautifully, but we don't want to stay in that place. We want to be able to expand then out and really identify what are the foods that they can eat. And in order to do that, you have to try the food. So there's still that fear that can be a problem with people.
Yeah, so I actually have somebody that I'm seeing who has IBS. So even people without eating disorders that have, like, because it manifests in a lot of different ways, right? So, but if it's directly related to a food and they're afraid of symptoms in public or something, what you would really do with that, especially if the symptoms have calmed down by like following whatever someone like you had given them to follow, then you can do EMDR on something like, I can handle it. I can get through it.
Mhm,
Because so that would be their positive thing, because what they're thinking is, well, if that happens, I won't be okay. So then it's like,
mhm,
I'm not okay. So if I eat this, I'm not okay. And then
mhm,
you do the EMDR and you lessen that they're not okay. It's like, no, you're okay. Like, you got
mhm,
through it every single time. And then you install the positive of whatever they want to think or
mhm,
believe. It's just an adaptive thought, and then it starts to feel more true as you're doing the EMDR, because we can't prevent everything from happening. Like if they have
mhm,
gut issues or IBS or something, it's like, yeah, we can't just say, nope, you're every food you eat, you're going to be fine. It's like, well, what if
mhm,
you're not? So it's just more, I can handle it. If something happens and I do have a reaction, like, I'm going to be okay. I know what to do. So it won't be pleasant, but I'll get through it.
mhm. That's huge. I love that. And I think it's so helpful to have that in an adjunct to the diet therapy, because like you said, they do need diet supplements. They do need to sort all that out to really get better, but they also have to sort out the mental emotional piece. Have you had experiences with, I would imagine, gut issues, other health issues with helping people?
Yeah, and it's pretty common too. So I work with trauma, anxiety, OCD, stuff like that. So I would say eating disorders are like about 70%, and then the other 30% is just a mix of people with different things. But a lot of people have chronic health issues. And I don't know if you've seen this, but usually if they're already with a nutritionist or a doctor, like they have a lot of data on what's going on with them, but just a lot of negative experiences around it. So you can do EMDR on like chronic pain. Like I said, feeling like you can't get through it or you won't be okay. If you just avoid everything, then that'll get you so far, right? But then it sort of inhibits your quality of life in other places, especially with food.
Yeah.
I mean, if you have all these restrictions, then there's a lot of things you can't do, social things you can't do. So the idea of, I trust my nutritionist, I trust my dietitian, just having more conviction that what you're doing is helping, that you can control what you can. And it's not like everything is just this big chaos. You feel like you have more control over your eating situations. And then if something happens, you know what to do. You'll figure it out and you'll be okay.
Mm-hmm. Yeah, I think that's huge. That's what a lot of people want. That's why they look at their diet. They want to be able to control, like, know what's okay, what's not okay. But then, especially, it's just so common that once they figure that out, they find that they're still anxious because they're
Mhm.
just so used to being anxious about this. It's almost like they don't know how to go back. I think this is a really cool thing. So does it work? Is it just like one treatment? Do they need multiple treatments?
So I've never had it work with just one treatment. Say it was just a food issue, like you're saying, where it's like they have a bunch of food allergies and, they're sick for days if they eat the wrong food. So if it was something like that and it wasn't tied to trauma, it's literally tied to I get sick and I have to not go to work for 3 days if I accidentally eat this food. So if it's something like that, you could do that in a couple sessions because, the first part of it, you have to set up the whole thing to do the EMDR. So you wouldn't do it in the first session, but you could process that out in a 60-minute session, I think. So usually we would do probably a couple for something like that. And then if it's something more chronic or childhood stuff or just ongoing negative experiences, or if they filled out like the ACEs form, the adverse childhood experiences, and there's a super high number, that's going to take a while. So that could take a year of doing EMDR. Not to scare you, but not doing EMDR like the whole time. Then if someone has a lot of trauma, like you do cognitive interweaves, and then you have to do mindfulness of case like you're triggered in between sessions and stuff like that.
Mm-hmm. Yeah, and I think even like what's the root and then what's the root. So when I do gut testing, microbiome testing, when we do food sensitivity or food allergy testing, we're finding a root cause, meaning we're not just saying take this antihistamine for your food sensitivities, which is kind of the standard medical, well, not for food allergies, I guess, but for gut symptoms, the standard medical approach is, okay, take this Imodium for your diarrhea. So we're looking at the root cause when we're doing the microbiome testing or SIBO testing, but what's at the root of, so let's say you have SIBO, let's say you have an imbalanced microbiome or you have leaky gut. Why is that? So I think from that perspective, it goes way back because a lot of the people I talk to, they've had anxiety their whole lives or trauma. And when you that, it affects your gut microbiome because of that gut brain connection. Stress and anxiety disrupt your gut bacteria. They can cause your gut to be more permeable because it affects your immune system. It can cause your gut to feel more sensitive. There's something called visceral hypersensitivity where your nerves in your intestines are more sensitive. So what to someone else, say the amount of gas production might feel like mild discomfort, for you it feels like daggers in your abdomen. So there's a lot to unpack, I think, that can go back a long way, whether or not the person even realizes that. Usually they don't realize.
Right. And so if you realize like this person is just not able to add foods back in because their anxiety is so high, like they're not willing to gamble, am I going to be in too much pain? You could do EMDR for acute things where you're just saying, okay, let's just work on that and I can handle it, and stick with that. You just stick with the target that you're working on. And then if that works, like a lot of times people start to be like, oh, well, I also have this, and then I also have this. And so,
Right.
right, because then they start to see, oh no, it does go back further, but it wouldn't matter if you wanted to do it on, long-term negative feelings and experiences, or you could do it on a flying phobia if you wanted to.
Yeah, I have that. I recovered from that just through lots of flying, but I'm sure that we all have lots of things to unpack. So I find it really, really interesting. And I definitely think for people who, I'm thinking about my clients who either see great results, but they're afraid to add foods in, or maybe they're seeing results at sometimes, but a lot of the time they're triggering their issues just from the stress of their life, and
Right.
really helping people. So if any of our listeners are in that category, if this is resonating with you, I know for a lot of you it is. How can people where do you practice and how can people get in contact with you?
So I practice in Tempe and I'm licensed in Arizona and Hawaii. So those are the two states I'm allowed to practice in. You can do EMDR over telehealth. It's done a little bit differently. It's kind of done through tapping. So you could do it that way. I usually prefer to do it in person. So my office is in Tempe. And then, but if somebody's looking for an EMDR therapist, there's the EMDR International Organization. That website is the emdria.org website. That gives you a list of therapists that are EMDR providers, and there might not be a ton like in your area, but if you went to psychology today or you went to your insurance and you did a search on EMDR or trauma therapist, then you're going to get a good amount of people that are going to come up that are able to do that type of therapy.
Awesome. Okay, that's so helpful. Thank you. So any last thoughts or anything else you want to share?
Well, I think everybody could benefit from EMDR, but it also isn't for everybody too, right? Like there's certain cases that you wouldn't do it, especially if somebody was like currently like living in the same type of traumatic environment. So you don't want to bring up EMDR on a traumatic situation and then they go home and they're in the traumatic situation again. Or
Okay.
someone that just has like a really low window of tolerance, or if someone's in active addiction, it wouldn't really work. But for everything else, now people say, oh, if you looked it up, it's for PTSD. And I don't have any big traumas and that nothing like that happened to me. It doesn't have to be for that. It could be for everyday things that you just feel like you can't handle and your body's just having symptoms and reactions. So
That makes a lot of
yeah,
sense.
everybody
Yeah.
to try it if they are in therapy or if they're thinking about therapy. It's just a bonus if whoever they're going to go see is also trained in EMDR.
Wow. Yeah, that makes so much sense because think of all of that we carry around that is long over, really from a practical perspective, it should only affect you in that moment, right? But we carry it through for so long. So,
Right. And so it's almost like filing it, like the thing that happened, like you can think about it and it's never going to be a pleasant memory if you were bullied in, sixth grade or something, but then it's kind of filed away and then it feels like it's in the past versus it happened yesterday. So that's kind of where it keeps your brain, it keeps things like where they're supposed to be. So past versus present. And then the present, it's like, yeah, stuff happens all the time. So you're just not going to get anxiety anymore because you did the EMDR. But it's like, oh, it only goes to this one thing. It doesn't go to all of these other things that we pulled up in the EMDR. And then it's not as charged in your
yeah.
body.
Yeah. And I think it sounds like this can help people understand why they're anxious too.
Sometimes they're like, gosh, I didn't even know that. I didn't even remember that. It would be a certain thing that happened. There's a lot more than people think. They're like, no, I think it probably happened like 3 times. And then say that feeling is not lessening, say it's still really high. And we're like, okay, we just process that one. You do it longer and there's more. So that's the other reason that EMDR can take a little bit longer is because there's way more in there. And then say that one brings up a different, like one of your different channels or thoughts. You just keep going until all of your stuff is cleared out. Because I would say people don't usually just have one. If they have a negative belief about themselves, they probably have a couple.
Yeah.
Yeah.
Yeah, absolutely. Well, this has just been so interesting for me. And thank you so much for joining us today.
Thanks for having me. I know I'm glad we ended up on this topic. So that's how I felt about it when I first learned about it. I was
Yeah.
like, hey, this is a game changer for therapy and for, ways people can truly have an actual shift, not just in their mind, but like internal shift. And then they just feel more at peace or lighter. And I love seeing it when people come back and whatever we were working on is cleared out. They're like, no, didn't bother me. So,
Amazing. Yeah, it totally makes me want to do it. I was majoring in psychology when I first
okay.
started college, and then I switched to nutrition, but 2 years I did psychology. So it's always been something I'm interested in. And I just think we all need a shift.
Yeah. Yeah. Even if you did it just to see what it was like and you pick
Yeah.
something small like that, like you would be amazed, I think.
Yeah. Okay. Awesome. Well, thank you so much.
All right. Thanks for having me.